Hey everyone, welcome back to my channel, Beautiful People, where we talk about physical therapy or what we use in physical therapy without getting you bored and doing your physical therapy. My name is Dr. Fiona, a doctor of physical therapy. Today we are diving into the world of physical therapy gadgets and gizmos like microcurrent point stimulation therapy, dry needling, cupping, and kinesiology tape. Some of them looks like sci-fi, some looks just painful, but big question is, do they actually work? Let's break in plain English. Okay, first things first, why do physical therapists use so many tools or different tools and techniques? Well, physical therapy isn't just flexibility, strengthening, movement exercises, progressive resistance, and manual therapy anymore. It's a whole toolbox of methods to help reduce pain, facilitate healing, and improvement movement and speed up recovery. Some are backed by science and others are a little bit so-so and controversial. So today we are cutting through the hype and getting real about what works and what might just be a fancy stuff. Let's start with something that sounds straight out of a Marvel movie. Microcurrent point stimulation therapy, or neurostim, dolphin, or MPS therapy. These uses super tiny electrical currents, 9 volts, applies cellularly responsive concentrated direct current, small but tiny stimulation to key acupuncture and trigger points. So the idea is that it mimics your body's natural electrical signals to boost healing, reproduce with our body's nervous system to facilitate and promote cellular healing and pain recovery. So it sounds super cool, right? But does it actually work? Well, some research suggesting it can help with wound healing, scar tissue, and inflammation. I would suggest this video. And some clients of mine helped with their recovery, but the studies are small and results are mixed. So it's not exactly a miracle cure. That said, it's non-invasive, painless, and generally safe. So if your physical therapist recommends it, it's worth a try. Just don't expect it to turn into superhuman overnight. So it's really worth a try. I really like this so much because it helps a lot of my clients, and I think it's also a good tool to use on your toolbox. Let's talk about dry needling. You've probably seen it, super tiny needles poking in a tight muscle. It looks like acupuncture, but it's not the same as acupuncture. Dry needling is based on modern anatomy and trigger points, and those knotted cranky muscle spots. Well, does it work? Actually, yes, because they have lots of research, and dry needling reduce muscle tension, relieve pain, and improved movement. It's especially helpful for things like neck pain, headaches, and athletic injuries. But I think this is important. It's not a standalone fix. It works best paired with movement, stretching, and strength training. Also, fair warning, it can feel weird. Some people barely feel it, others feel it, twitching, soreness, it varies. So if you are needle shy, talk it out to your physical therapist first before you try this. It's very interesting, and I want to point it out that we usually sometimes we usually use electricity while using this one. It's also helpful to facilitate wound healing and going deeper with the muscles. So I think it's very helpful. There are different types of brand of needles, and hopefully you can take a look at some of the research base. There's tons of research has been done for dry needling, and I think that makes it more stronger. But MPS is also one of the best thing I would like, because it doesn't poke you or anything. It just uses electricity, and I think I would refer you to read this book, The Body Electric, and it's very nice book to know more about electricity in our body. And then you can have an idea like why MPS, for me, kind of like my go-to first before I do dry needling. Next up is cupping. If you ever seen someone with purple circles in their back and thought, did they lose a fight with an octopus? That's cupping. It uses suction cups to pull the skin and supposedly increase blood flow and reduce tension and promote healing. Does it actually work? Well, here's the deal. Some studies suggest it can provide short-term relief for muscle tension or pain, but science is kind of shaky. A lot of experts think it works more through placebo, meaning people feel better because they believe it's helping. That said, it's low risk and some folks loved it. So if it helps you chill out and recover, you are cool with the Mars. Go for it. Just don't expect it to fix your injury by itself. I think it's also cool, but be extra careful with people who are taking blood thinner, people who are diabetic, people who have sensitive skin. But make sure you follow the guidelines on this one, and I think you're gonna be okay for all the physical therapists. And I think it really depends on what muscles are you addressing or what kind of issues are you facing. So more than likely it's very helpful, and I think it's also good, but research has to proven so much more or do a lot of studies, and a lot of researchers can do much of this, so then it will be very, very helpful for us to say like, okay, this actually works. All right, let's talk about the rainbow colored tape you see on athletes. Yeah, that is a kinesiology tape. It's stretchy, it's sticky, and supposedly lifts the skin to help with circulation and support. So does the tape actually do anything? Well, my thing is sometimes there's some evidence it can provide mild pain relief and help with proprioception, your body's awareness of position and movement. But if you are hoping that it will keep your shoulder from dislocating mid-game, yeah, not gonna happen. So it can be a great supplement, but not a substitute for proper rehab. So tape it up if it helps, but don't rely on tape alone to keep you going. So still, the science or the evidence or research for KT tape has not been really proven that much. So hopefully, when you look at it, it's always based back up in science and something really helpful for you and your practice to really benefit the patient. So I think for some people, if it likes them and it helps them, as I said, it can be a good thing to use in your practice or for all physical therapists out there. So ever had that warm jelly covered wand rubbed on your shoulder during PT? That's therapeutic ultrasound. It uses sound waves to supposedly heat up tissues and help them heal. But here's the kicker. Research says meh. Most recent study shows little to no benefit for most injuries. It's been around for decades, but it's kind of falling out of favor. So unless your therapist has a really specific reason for using it, you might be better off with movement-based treatments. And I do think there are some areas of the joints when they use therapeutic ultrasound to address those areas, like your knee, is very helpful. I do think that we can look into research studies of using therapeutic ultrasounds for patients, and it's very helpful. There are already some therapeutic ultrasounds that is on the market, and make sure it's something that benefits the patients and useful for the patients. And I think that would be good in some way because it's a specific joint tissue that you are working on. So after all these gadgets and techniques, you might be wondering, okay, but what actually works? That's a great question. Here's the truth. Most effective stuff in physical therapy isn't flashy. It's exercise, strength training, stretching, education, and consistent movement. These are the things that really help you heal, prevent injury, and stay strong over time. The tools we've talked about today, they can absolutely help facilitate the healing process, but only when they're part of a well-rounded plan of care. If your PT spends every session putting gadgets on you and never gets you moving, that's kind of a red flag. Well, everybody's different. So I just want you to be more of an advocate for yourself, and movement is the only way for you to gauge whether you are really improving. Let's say, for example, my shoulder is hurting and I can't barely raise my arms up. And if there's no stretching, strengthening is done, and it's only those gadgets, and I do think I have to be worried about that. But those are things that I want you to, weigh things in and just be an advocate of yourself and your health, most especially. So do microcurrent, dry needling, cupping, and taping work? Sometimes yes, but they're not magic. Think of them like spices in a recipe. They can add something extra, but they're not the whole meal. The real work, the stuff that actually changes your body, comes from moving, strengthening, and building habits over time. So I want you to read this book. Thanks for hanging out today. So if you've learned something new, hit that like button, subscribe for more down-to-earth health content, and drop a comment below. What's the weirdest therapy you've tried? See you next time, and keep moving. I appreciate you guys. I adore you. Thank you so much for watching, and I'll see you soon. Bye.